don't go to work. They don't go to work. They don't go to work. They don't get food. They don't go to work. They don't get food. They don't go to work. They don't go to work. Good afternoon, good evening, good morning, even, wherever you may be. This is Firoz Manji from Daraja Press. Welcome to Organizing in the Time of COVID-19. My guest today is Paul Christian Namphy from Haiti. He works on the nexus between water, sanitation, and hygiene, a lovely acronym WASH, the health sector and community involvement in Haiti. Formerly in the public sector in the struggle to provide water, sanitation, and hygiene services in displaced persons camps after the 12th January 2010 earthquake in Haiti. And to eliminate cholera in Haiti, which was a major tragedy involving, unfortunately, the UN itself. And his role now is pivoted towards the battle against COVID-19. A warm welcome to you, Paul. Thank you for sparing time to join us. Tell us a little bit more about the sort of work that you're doing in terms of engaging with the community in relation to COVID-19.
Thank you so much, Feroze, and thank you for this opportunity with Daraja, with People Strike, to really share some of the challenges that we're facing here in Haiti. And we see that the struggle that we're engaging here in Haiti is very, very closely linked with the struggles that people around the world are facing, which were obviously very clear prior to COVID, and now COVID has added yet another dynamic. So the most important component of what we're doing in engaging the communities are life-saving activities. And these life-saving activities center around making sure that people have adequate access to water, sanitation, and hygiene services in the context of the various COVID response activities. Two of the very key response activities are, first of all, prevention, sensitization, key messaging around questions of distancing, questions of hand washing, questions of wearing a mask, which I do on a constant basis, except when I'm on this interview. So these are very, very, very key issues, and we believe that the extent to which communities appropriate and interiorize basically these basic messages, we will be effective in preventing the spread of COVID. Now, clearly within this, that's the sensitization aspect. The second aspect is the question of actual care. We want to make sure that when people are sick and they are seeking care, that they have access to a care facility which allows them to be properly treated, and that those care facilities are properly equipped with water and sanitation infrastructure. So those are the main points. And we realize that there are many issues around stigmatization, issues around how people perceive COVID, and how that links to how they perceive the authorities and the messages that the authorities are sending to them. So that is clearly a very key component in this struggle.
Well, let's get to that. Help me understand what is the situation in terms of COVID and its spread in Haiti. How serious is it? How fast is it spreading? So that we have some sort of idea of where we are.
Great. So here there obviously are two narratives, and that is the case whether we're talking about Haiti or that is the case whether we're talking about anywhere else in the world, because there are public figures, there are official counts in terms of the number of people who are confirmed cases, people who are confirmed to have the disease based on a lab test, and the number of deaths. of people who died who had been confirmed to have had the disease. But then we know that those figures do not represent the true reality of what is happening. So basically, looking at the specific figures of the situation, we have till date, we have 7,340 cases that are confirmed, and that is through the 26th of July. There unfortunately have been fatalities. We have up to 158 confirmed fatalities. Now, we know that in the reality of the matter, those numbers are much higher for a series of reasons, and that often links to the situations of social exclusion, the situations of marginalization of communities that we have been facing for decades and indeed for centuries, where, first of all, people's distance from basically the state ability to reach them, to test them, because obviously case counts are directly related to who can be tested and who can not only be tested, but the results of which can be produced in a reasonable time frame. And when those relationships of trust break down, and when the people do not receive their results within an adequate time frame, people naturally, based on the limited information that they have, often withdraw from the entire mechanism, and this creates a difficulty in terms of knowing exactly who is sick. So we are absolutely 100% confident that the true numbers of people who are infected with COVID, and even of those who died from COVID, are much higher because of a lot of these questions of stigmatization and really of fear of engaging with the system.
And it is the fear about being recognized, a stigma of having COVID, or is it deeper than that? Is it related to the political situation in terms of how the state itself perceives them?
Right. So I would argue that the former entails the latter, because all of our communities, and again, this is really a worldwide struggle that we're facing, whether we are talking about Haitian people, whether we are talking about Kurdish people, whether we are talking about people anywhere in the world, women or men, we know that oftentimes everything is political, but it's a question of layers, it's a question of degrees. And so, yes, there is absolutely a question of stigmatization. And again, part of this is related to a lack of information that people have received. And part of this also, I must say, relates to certain groups with an agenda, sometimes governmental, sometimes outside of the realm of government, which, in the absence of an official link between the authorities and communities, many groups will fill the gap with very, very, very perverse messaging about, well, if you try to reach care, then if you go to the health facility, then there are people with who might try to vaccinate you, but they have some sinister agenda. And a lot of these messaging reaches the communities more easily and more directly than the actual messaging that is attempting to give proper information about what people should do in the event that they have the signs and the symptoms. So I think this has been one of the main factors in preventing people from getting care, because we're dealing with folks who have not received basic education. Just in the neighboring island of Cuba, where based on the system that they have, health and education is basically guaranteed through university on the education side, and health lifetime. We simply have not had that here in Haiti, and the majority of Haitians have not had access to affordable education. So in the absence of their basic understanding of disease transmission, other forces often enter that realm with very adverse messaging, which causes yet another hurdle and adds to the stigmatization element, where in communities, particularly rural communities, no one wants to be associated with the COVID disease. You have a great deal of denial of being sick, and even some of the fatalities, it's very difficult to do post-fatality testing So again, this adds to the uncertainty not only of who has and doesn't have the disease, but also the ability to cut the chain of transmission.
But are there any surprises given that over the last almost more than a decade, the role of international organizations who have come with their own agendas with an attempt to, well, to be blunt, make money out of impoverishment. Is that still the case?
Absolutely. And I would argue on two levels. First of all, strictly on the economic level. And I'm not going to necessarily single out specific groups here, but we have often seen this agenda, which often masks itself with religion, with spirituality, with organized religion, somehow to appeal to the poorest elements of society, to contribute a sizable portion of what they do not have, to enrich people at the top of the ladder, who will then be building fancy houses and driving nice cars. And we know that this phenomenon is not specific to Haiti, but there's a specific deleterious component of this in Haiti, with the destruction of the cultural and the social fabric. We have a very vibrant culture. We have a very vibrant system of beliefs which help buttress our struggle to become a free people. Over 200 years ago, 1804, we were the first declared Black Republic. We were the first independent country outside of the United States. In the Americas, we were the first country in the Americas which had freedom, if you consider freedom of everyone, because of the whole question of the legacy of slavery, which had existed in the United States and other places at that time. So we come from a long struggle, which dates over 200 years. And part of the component of many of these groups going into is to destroy that cohesion of the local culture and really redefine the Haitian identity in many ways, in which we lose that link to who we really are, and that creates a whole series of other negative byproducts. So that those are things that we need to be thinking about as we continue this conversation.
Yeah, indeed. I mean, 1804, you say, absolutely critical. The first most successful slave revolution, and it's not just that. It's a context in which they defeated militarily the Spanish, the French, and the British, and Napoleon had to retreat from that. So there's a huge history. Many of us have seen that this is part of the history of Africa as well as of the Caribbean. It's important that is recognized, because the question I have for you is, to what extent is that consciousness still there? To what extent is that memory alive? To what extent does that provide a framework for political organizing?
Thank you so much for that question, because that is really the key question. We were the first successful slave revolt since Spartacus over 2,000 years earlier. We defeated the Napoleon and his hegemonic slavocracy vision of relations long before the Russians did, and the Russians in their winter. So 200 years later, this is the reason over those past 200 years, one of the reasons why we've been attacked as we've been attacked, in addition to questions about questions of capitalist hegemony and control of resources, which is another very key aspect of that. But looking at the situation today, I would say that we are in crisis. We are in a crisis because of the success of the opponents of what a true enfranchisement of the entire Haitian nation of women and men who have been struggling for dignity to all, along lines of gender emancipation, along lines of social emancipation. that is in crisis right now. We've been fragmented, we've been divided. We're facing a situation where just 2 or 3 decades ago we had a very strong, vibrant social movement here, which toppled various dictatorships and which really required the national and international anti-popular sovereignty stakeholders to basically to the bargaining table, to elections in which their favorite candidate did not win. It was the popular candidates who won in 4 consecutive elections. And unfortunately, we must admit that this mass mobilization does not have the strength that it did several decades ago and really has to be rebuilt. And in the meantime, it's been very, very, very difficult. I must say that, to be fair, we saw hundreds of thousands of Haitians on the streets in the last few years, and we're talking about the year and the year or two before COVID, with a very clear message of what they were against. Okay, but today we see the crisis of defining what we are in favor of, and the crisis of getting together in terms of having a common agenda, and also the crisis of leadership in terms of who specifically is a credible leader to challenge and to move things forward. And because of many of those contradictions, we face a standoff which continues until now, and we face a situation where COVID has attacked us at a time when we were not properly prepared. Perhaps if we had made other decisions the 2 years beforehand, we may have been in a very different situation. But what is very interesting, Firoze, is the resiliency. We still see the resiliency. We see that countries like the Dominican Republic, places like Florida, which technically should have been far more prepared than we are, which have very similar climate than we do. And yet, even if we factor in the error margin of who are the confirmed cases versus who is truly infected, somehow the people inside Haiti have been less affected by the COVID virus than the Dominican Republic and then Florida. And so this is a question, this is an enigma that has to be seriously thought of about how we've been able to accomplish this.
Why?
Again, this is the enigma. I mean, I believe that the efforts that we have made have had some impact. And to be perfectly honest, on a daily basis, I am living situations where there is, again, a rejection of basic science. There is a rejection of the required barriers and barrier behaviors in terms of preventing the spread of the disease. There is a rejection. The uptake has not been what it should be. And yet, in terms of the actual infection rates, so far they've been very, very, very low. And in a way, there's a certain perverse aspect to that, where it's good that these rates are so low. Sometimes people see these very low rates of transmission and think, oh, somehow the risk is not there. The risk is definitely there, and people need to remember that. But the impact of COVID on Haiti in terms of number of people infected, number of people who have died, has been less than Florida, has been less than the Dominican Republic. And I mean, that is a fact.
But at the same time, you started off by saying that these are gross underestimates of what is actually happening.
Yes.
They are.
It's also true that the numbers in Florida are underestimated. It's true that the numbers in the Dominican Republic are underestimated because the system's possibility to detect who is sick, and even among the dead, who among the dead was contaminated, in all of those 3 forums are imperfect. And probably we have less grip of that than we do in the Dominican Republic or the United States. But the numbers are so different that it's safe to presume that even with those error margins, we still somehow have come out less scathed than those other 2 places that I mentioned.
Right. So help me understand. I mean, I know I've never been to Haiti, but I know of big ghettos, big cramped areas where vast numbers of people live in Port-au-Prince and in some of the other cities. But this is a situation very similar to, for example, where I come from in Kenya. Uh, Large numbers of population, majority of population in Nairobi live in these ghettos. The possibilities of social distancing are mythical. There's no water anyway to wash your hands with. So it's a serious situation in which the state has operated, and in many countries in Africa have operated to militarize the streets, to lock people down, and even in Kenya to introduce a curfew, so that on the presumption that the virus doesn't spread at night. Um, and are there parallels in Haiti?
Habari za asubuhi. What I could tell you is
No.
that we have this is a very unique situation that we're facing in Haiti, and I consider myself a person with a movement background, very steeped in the question of enfranchisement, of empowerment of the majority, the empowerment of women, the empowerment of traditionally oppressed groups. I think that it's in this particular case, it's a mistake to understand the current state apparatus as primarily a COVID-based repression model. And we have seen that in other parts of the world. Sometimes many of these measures, one may have a scientific argument that some of these measures are warranted. Obviously, you have dictatorships around the world which have been using the COVID crisis to enact terrible harm among the populations. Again, I would point specifically to the dictatorship in Turkey and how it is using the COVID mechanism, particularly against women of all nationalities inside Turkey, and particularly against the Kurdish population. But here in Haiti, what we see is a very strange dynamic where the flaw of the state as we know it is the flaw of state weakness, meaning it's the flaw of inability to provide the basic services across the board. Okay. And COVID, because of the heightened dangers, adds several additional dynamics to this. One of the dynamics is just the incapacity to reach certain communities. I was just in an area called BDN, okay, and which is in the northwest of Haiti. This is a great example. There has been one confirmed case of COVID in BDN, and yet we know with almost certainty that the real numbers of infected people are much higher, probably 40 or 50. That's not to say that throughout the country you would have a similar ratio of people declared infected to the real numbers of infected people. But in that particular area, it is so difficult for the geographic department health entity to send the testing team to reach BDN with a reasonable delay so that people would have confidence that they can take the test, that they can get the results. So that figure has no bearing on the reality there. And again, this is an example of state weakness. Okay. And the second example is in terms of the credibility of the message, because when you have a situation of the inability to provide timely resources, and declarations will be taken out of context, and that further undermines the ability of their declarations to be believed. And a lot of this credibility gap, obviously, before COVID, many promises which were made, which the majority of people feel were not kept. Okay, and again, this is prior to COVID, but this has a spillover effect in the COVID era, where basically the last is, of course, that the numbers of people sick and the numbers of people who died are far lower, not only than our neighboring countries, but also than the predictions that they had made about Haiti, including the authorities. And those predictions were made often in a vein of, behavior change needs to occur in order to avoid this. Okay, but in the end of the day, the actual numbers of sick, the actual numbers of dead are, maybe between 1 and 10% of what those dire predictions were saying about perhaps maybe thousands of people dying a day, as we've seen in other parts of the world, including some areas not so far from us. So I would say that the weakness of the state paradigm is really what we need to see. So when you talk about curfews, maybe in other parts of the world, the curfew is having a repressive effect, and that is creating a backlash among popular resentment. In Haiti, the curfew is put into effect, and virtually nobody abides by it. So it's a very, very, very different dynamic that we have here. And basic measures, for example, we have the tap. Those are collective transportation, the colorful, pickup trucks with a hood on them. I'm sure you've seen them in the pictures. So one thing we could do is to say, well, similar to the banks, similar to the main markets where a mask is required, we could have requirement to wear a mask in the taps, which could be a measure to to decrease the transmission of the disease, but we have not been successful in that either. So this is just showing, as a society, some of the shortcomings, that yes, some of these measures are in place, but the main effect is less effective of excessive coercion, and often just the effect of ineffectiveness, unfortunately.
Right. A number of people that we've interviewed across the world have pointed out that what COVID has done is to remove the veil from our eyes. It's revealing the nature of capitalism, the nature of the society. To what extent would you agree with that?
I would say that there are parts of the world where that is 100% accurate. And again, I believe that if we look at the question of the dominant forces in world society today, whether they be the nation state, whether they be capitalism, whether they be patriarchy, we have to see that these are forces that have been driving the era of what we could call capitalist modernity from, if we look at this from a democratic confederalist perspective. And clearly, COVID has burst apart many of those contradictions. And it's very strange to see that, at least in the Americas, the two nations which have the worst forms of patriarchy and misogyny and disrespect of women and of women's empowerment, which are clearly President Trump of the United States and President Jair Bolsonaro of Brazil, happen to be the two countries where COVID has absolutely exploded and is off the charts. And if we look at other countries, other societies, such as Germany, such as New Zealand, which are run by women, and you have a very different impact. And in many cases, COVID has been brought under control. And this has been written about. It's not just me that's talking about this, but there have been studies about this. But I would say that it's definitely a crisis now, where we are seeing that COVID has transformed the discussion. With, for example, even the distancing, the fact that communities which would have been very difficult to hook up with each other prior to COVID, this has provided an opportunity via forums like this, Zoom, like WebEx, where we're able to globalize the resistance, globalize the struggle, globalize the organizing and the demands for an empowered society, where women, where people who believe in social ecology, where people who believe in community control over resources, people who believe in direct democracy, people who believe in local political control, and to limit the effects of the multinational corporations, the effects of overarching nation states. Obviously, we can point to the example of the autonomous administration of Northeast Syria, Rojava, where these effects are in place and working very well until the recent Turkish invasion, which has been brought this into risk. But you see the vibrancy there, and I think communities around the world their eyes are opening how COVID has unmasked many of these contradictions, and people are saying they need to take control over their situation. But there is, I would add, a very big risk that many times the interpretation of what needs to be done in this context, sometimes, in my view, incorrect assumptions are being made. And in those, you see oftentimes the denial of the disease. And I'm not just talking about Trump and Bolsonaro. Even within Haiti, we have a very big current of COVID deniers. And that's not just among the powerful. In many ways, these are traditional disenfranchised groups, sometimes who have been struggling for a dignified existence, but which have reached, in my view, an incorrect interpretation about the reality of the disease and what should be done to prevent that.
Yeah, you mentioned Germany, New Zealand, and so on, but people often forget Kerala, which has had an incredible strategy for eliminating. Just really impressive. But it's not just Kerala. I mean, we're seeing it in South Korea. We're seeing it in Vietnam, and indeed in China. I mean, it just goes to show that it can be done. It's
Yes.
rocket science in that sense, unless you leave it to fester on its own. But let me ask you this: what does it mean to be organizing in the time of COVID?
So organizing the time of COVID, again, we have, in my view, it's very important to continue to focus on what we could call functional strategies and functional goals. Okay, because if the strategy is, let's, in step one, do everything we can to limit transmission, because that will save the lives of our female and male comrades. That will save the lives of people who are at risk. That will save the lives of communities, of individuals who have children, who have parents, who have brothers and sisters. So, that, in my view, has to be first, and, I'm not often plugging for the United Nations, but I will say that Secretary General Guterres' call for across the board ceasefire, okay, so that we can, as a human society, move toward focusing all of our resources toward sensitizing people, toward health, toward education, rather than the continued military conquests in the Middle East and elsewhere that we see. This would move the entire possibility forward. This would allow additional space for movements to organize, rather than fear being constantly repressed. And it's an absolute travesty that we see, nations like Turkey continue to engage in repressive behavior and in illegal wars, which, despite the call by even the United Nations for a cessation of all hostilities, to allow all of the capacity to focus on life-saving and preventing the disease. So organizing has to be around concrete goals. I think life-saving and disease transmission has to be the number one priority right now until we have a grip on the pandemic. I think the second question is resisting the efforts of certain states, of certain nation states, to take COVID-19 as an excuse to repress communities and to push back on that. But again, it's important to push back on that in constructive ways, which do not increase the risk of the disease spreading. So I think we have to calibrate our goals. I think that, yes, we have to have a vision about what, as an international, either an international movement, but more precisely an international collective of local movements, how we can to really implement our agenda, which we, prior to COVID, were trying to implement. But obviously that we have to get through COVID first.
So a final message, something that helps us understand where the cracks are, where the light can get in.
Okay.
Um,
So I'll start with Haiti, which is where I am right now. COVID has been a terrible tragedy here, as COVID has been a terrible tragedy worldwide. Different societies have been affected to a different extent. I think that despite this terrible tragedy here and abroad, COVID provides us with an opportunity. And what is that opportunity? That opportunity is to do things right. And the first step in that, and that comes back to your organizing question, we have to organize along viable and functional lines. And that means that the leadership has to come to an agreement. That means that the bottled up frustration that people feel was very clear in the streets of Haitian cities in the year or two prior to COVID, that has to be channeled toward functional goals of people really retaking control of their lives, of their communities, of their resources. And so this is a wake-up call. This is a reminder that from here on out, we do not have the luxury of infighting. We do not have the luxury of putting personal gain and personal agenda above the collective well-being. We do not have the luxury of remaining within paradigms of patriarchy, paradigms of the control of the many by the few, paradigms of non-community and local control over resources or of governance. So I think that is the message that we have to get across. And that is true for Haiti. That is true for other parts of the world. One final parallel, the people of Northeast Syria, they are not able to become free because of international constraints, because you have a foreign army, the Turkish army, combined with jihadists who are recycled people of ISIS, recycled people of Al-Qaeda networks. So they really are in a situation where it's up to the rest of us to try to break that down at an international level. The people of Haiti today, we can have self-determination. We can have autonomy. If the community of Haitians comes to a decision, we can enforce that decision. We do not have the constraints that the Kurds have. So again, we've been a recognized nation for over 200 years, and we have to, coming back to your second question, we have to build on that tradition of resistance, of emancipation, to build something beautiful, to build something empowering. Okay, and again, we have the COVID context, and we have to resolve the COVID question and then move from there.
Paul Namphy, thank you very much for sparing time to be with us on organizing in the time of COVID-19. Really appreciate your sparing time, because I know you are directly engaged every day in the clinical and preventive work associated with COVID-19. So I appreciate your sparing the time.
Karibu sana, and a word of Creole, oui nous capable, which means yes, we can. Thank you so much.
Okay, great. Thanks for joining us.
Thank you.
That was Paul Christian Namphy, who's in Haiti and is in the forefront of trying to deal with the problems of COVID-19. Seems hopeful that, in spite of the inaccuracies of the number of cases, that the situation is not as bad as in countries, to say the least. I'd like to thank you, Firoz Manji from Daraja Press. I'd like to thank you for joining us here on Organizing in the Time of COVID-19. And I was very careful there, because several people have pointed out to me that I keep saying organizing in the time of chaos. Well, maybe that is the right word. But in the meantime, I leave you to enjoy your day, and we will be back online again tomorrow. Thank you for joining us.
don't go to work. They don't go to work. They don't go to work. They don't get food. They don't go to work. They don't get food. They don't go to work. 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 They don't get food. They don't go to work.